Hi, I'd like to talk about lumbar stenosis. Stenosis is a term that refers to crowding or narrowing of a canal. So anything that crowds a canal we can consider stenosis. I'm sure some of you have heard of aortic stenosis. That's the big artery that comes from the heart, and if it gets narrowed, we call that aortic stenosis. When we're talking about the lumbar spine, the stenosis is typically caused by arthritis that over time crowds the canal where the nerve lives. So if you look at this MRI, this is the side again of someone's spine. The tailbone is down here, stomach is on this side. The nerves live in this white fluid-filled canal back here. In the front is the bones or the vertebra. The dark things are discs. This patient is in their 70s, so this is a typical finding that we'll see. The discs have become dark and narrowed. You see some arthritic changes throughout the spine. The important thing is the nerves. These gray strands are the nerves, and they live in this white fluid-filled space. Up here at this level, you can see how the canal is quite open and there's enough fluid around the nerves. But as we get lower, the arthritis from the back has started to buckle in, narrowing the canal here. And you'll see a disc bulge from the front. Between the two of those things, they narrow the canal, and that causes what we refer to as stenosis. You can see it at multiple levels in this person's spine. Now I'm going to show you another slice across the spine this way. So what we're looking at here is a transverse slice across the low back. This is a bone here. There's that white fluid-filled canal with the white fluid and the gray nerves in there. The person is lying on their back. At this level of the lumbar spine, there's adequate space in that canal for the nerves. As we start going down toward the feet, you can see the nerves are now very crowded in this little triangular shaped canal. The main reason for that narrowing is the joints here in the back have become arthritic. And just like people get arthritic knuckles in their hands where the knuckles get big and knobby, that's the same process that happens to these joints in the back. However, when it happens in your back, it starts to crowd the nerves, and that's what we call stenosis. Now, as we go down toward the feet, you'll see that the canal opens up again here, and there's adequate space at this level for the fluid and the nerves. As we come down, you can see this level is now crowded by these big arthritic knobby joints in the back. Now, stenosis, when the nerves get crowded, can cause nerve pain. Typically what happens is people complain of lower back pain or pain into the gluteal area or down one or both legs when they stand or walk. Typically when you stand up straight or try to walk, you're closing the canal down a little bit more. If you lean forward and hold onto a shopping cart or sit down, it opens up the canal, and that typically will give people a little bit of relief of their nerve pain. So you'll see people naturally starting to bend forward more and more as they walk, because when they try to stand up straight, it pinches the nerves. That's a very common finding. The way we treat lumbar stenosis is with medication, physical therapy, and epidural steroid injections can be very effective. A steroid is essentially a very powerful anti-inflammatory, and we put it right where these joints are arthritic and swollen and crowding the nerves. And that can give people significant relief for weeks to months to even years. Sometimes if the nerve pinching is not improved with the physical therapy, medication, or injections, we'll consider doing what we call a micro-decompression surgery. I like to call it a roto-rooter, but a lot of people don't remember what roto-rooter is anymore. So essentially what we do is make a small incision in the back, and we come in and clean out the arthritic material that's crowding the nerves in that canal. That's called a micro-decompression. You'll hear terms like laminotomy, laminectomy, partial medial facetectomy, foraminotomy. Those are all parts of the decompression. This type of surgery is very effective. People do extremely well when it's needed.